for our CEO, Bwana is here. Wapi wale watu wangu wa mkono na the specialists, all staff of Sabatia, are you here? Or they are busy somewhere? I want them to stand. Wapige kigalagala moja ya kukaribisha hawa wageni. Asante sana, Your Excellency. We have now a staff of almost 150, growing from very kidogo, and that is because of having opened this unit in Kisumu and Eldoret. We are looking forward to opening a unit in Nairobi, specifically at Jomo Kenyatta University, so the numbers are going to go up a little bit because this work that is in progress in collaboration with our partners, and we are hoping that with assistance we hope to get, we shall be able to do that. So I want to stop there so that we can give our guests the opportunity to talk to us. I was only introducing ourselves to you and our partners, because our partners have become part of us. And I want to keep stressing the fact that we are extremely happy with the partnerships we have been able to forge, and we are always looking for new partners. Something I want to say here is, hii hospitali sisi tunategemea watu kutoka nje kuchangia pesa, wanatuletea tunajenga. Unajua ni watu kawaida tu kama sisi. I want to see, whether it's through our Lions clubs, our Rotaries, etc., that we people here can also come and support our institutions. I have children here in the wards. Come and give us a set of toys and things like that, or come and tell me we want to do a playground for these children, and you will have contributed something that is big in the life of those children. So that is just a challenge I want to leave, that we should not just be talking about partners as big people from out there who have big money, because that money many times comes from people like you and I. So I want to stop there and say thank you very much for coming.
Asante sana.
And doing this for us.
Thank you. Thank you. Tumpigie makofi mwenyekiti wetu. Makofi tena, makofi tafadhali. Asante sana kwa maongezi mazuri sana. Sasa nitaomba kwa heshima tu, kwa sababu tumeanza kuchelewa. Tafadhali tuchukue muda mfupi zaidi, dakika 2 tukienda sana. Kwa hivyo naomba uzungumze ukiface upande huu, ndio ukiona MC hapa ujue wakati wako umekwisha, tutumalize haraka. Sasa kwa heshima kubwa na kwa ruhusa yako Mheshimiwa Mkuu wa Mawaziri, naomba nimuite County Commissioner Bwana Gilbert Kitio azungumze kwa kifupi.
Asante sana mwenyekiti. Our Prime Cabinet Secretary, Honorable Musalia Mudavadi, our guest, Daktari Susan Nakumicha, who is also our CS for Health, our Governor, Dr. Tijilo, our MP, Mheshimiwa Siloya, Chairman of the Board of this hospital, and your team, the staff and all protocol observed, good afternoon. Amjambo. Mimi sitakuwa na mambo mengi ya kusema. Kwanza nitafanya kujitambulisha. Naitwa Gilbert Kitio. Mimi ndiye County Commissioner wa Vihiga hapa. Nimekaa hapa siku kidogo kama miezi 2 hivi. Na ninaahidi kwamba tutafanya kazi pamoja. Na kwa sababu ya mambo ya masaa sitasema sana. Ningeomba wala administrators tuko na wao, machief tafadhali mtasimama tu na mpige saluti moja hapo kali. Aya, salute. Asanteni, mnaweza keti. Tuko na Assistant County Commissioner wa hapa. Sijako upande gani tumuone pia. Tuko na Assistant County Commissioner na tuko na Deputy County Commissioner ambaye pia anakaa kwenye hii board ya hapa. Naona wamama wako na nguvu sana. Siku hizi hata sisi tumeanza kuwa marginalized. Basi mheshimiwa, nimefurahi sana kufika hapa. Kabla ya kufika hapa nilikuwa nimesikia mambo ya Sabatia, lakini sikuwa nimeielewa. Kwa nasikia watu wanasema tupeleke Sabatia, iko huduma nzuri. Nilikuwa najiuliza hii Sabatia ni ya nani? Leo nimepata majibu kamili. Na ningependa tuwapatie makofi ya kilo wale walianzisha hiyo hospitali, ikiwemo waziri wetu Prime Cabinet, ikiwemo wale partners. Unajua hao partners wanatoa pesa yao, hawana ushuru, wanatoa yao. Tuwapatie makofi ya kilo moja. Asanteni kwa hii facility. Sisi role yetu kama National Government Administration, sisi kazi yetu ni kutoa ile inaitwa assist. Wala wanapenda mpira. Unajua assist, kusaidia mtu afunge goli. Sisi huwa tunasaidia idara zote, tunasaidia partners wote, tunasaidia viongozi wetu wote ili waweze kufunga hiyo goli. Na hapa sisi tutaendelea na hiyo jukumu ya kufanya sisi tusaidia idara zote, facilities zote ambayo inasaidia watu wetu. Kwa hivyo sasa mimi najicommit kwamba tutafanya hiyo kazi ambayo ni kazi yetu. Sisi kama utawala pia ni kama ile dawa. Kuna dawa moja kila mtu anapewanga akienda hospitali. Huo mgonjwa wa kichwa, tumbo, huo na kinonda, hiyo dawa inaitwa painkiller. Sisi kama watawala wa mkoa utatupata kila mahali, kwa sababu sisi ndio painkiller katika serikali yetu, na tutaendelea kutimiza wajibu huo. Kwa hivyo sitasema kupita hapo. Nashukuru wageni kwa kufika siku ya leo na kusindua zile miradi ambazo zimezinduliwa, na kuwashukuru pia partners wale wametufanyia hivyo. Mungu awabariki sana sana kwa hiyo.
Asante sana.
Sijui kama niko na jukumu lingine.
Uko sawa kabisa.
Basi asanteni sana na Mungu awabariki. Thank you.
Asante. Tumpigie makofi tena County Commissioner wetu. Shukran. Mheshimiwa mkuu wa mawaziri, sasa nachukua fursa hii kumuita area MCA ambaye ni Vincent Atiaya afanye mambo mawili. Awatambue MCAs wote walio hapa na uongozi wa County Assembly, na vile vile aseme yake machache tu alafu amalize. Karibu sana mheshimiwa.
Thank you, Your Excellency. Prime Cabinet Secretary, Mheshimiwa Musalia Mudavadi. Cabinet Secretary for Health, msichana wetu hapa nyumbani, Nakhumicha. Nimesema vizuri? Nakhumicha. All protocol observed. Mirembe bosi. Hamjambo. I would request the MCAs who are here to step forward, please. MCAs who are here, step forward, please. I request the House leaders to remain behind. The Deputy Speaker and the Chief Whip Majority remain behind. All the others, please. You just introduce yourself, please. You don't give speech, just introduce yourself.
Your Excellency, Prime Cabinet Secretary, together with our CS and other guests who are around. My name is Gertrude Lumire, nominated MCA on ANC ticket. We are happy to be here. Welcome.
Thank you. Asante, tuende hivyo haraka haraka.
Our Honorable PCS, CS and all protocol observed. Good afternoon. I'm Atieno Rita, nominated MCA ANC ticket from Luanda sub-county. Thank you.
Asante kuwasaidia kwa sababu nilisoma protocol, tuseme tu majina moja kwa moja tafadhali.
Honorable Fela Jega Mieso, nominated ANC. Asante.
Good afternoon everyone. Honorable Florence Kegode, Busali Ward.
Waziri mkuu na wageni wote hamjambo. Jina langu ni Franklin Muhindi Gidali, MCA West Sabatia.
Mimi naitwa Nkuruma Abudiku, MCA Sabatia Duywa. Thank you. God bless you all.
Asanti, mimi naitwa Kaisha Vena nikiwa nominated MCA on ANC. Karibu nyumbani mama, karibu mama Nakomicha, karibu karibu wamama hai. Wamama hai, mbarikiwe.
Hamjamboni wote? Hamjambo tena. Bwana Yesu asifiwe. Mimi naitwa Mheshimiwa Pauline Amwata, MCA Central Maragoli Ward, Majority Whip. Tena mimi ndio Vice Chair Health Committee, Vihiga County Assembly.
Asante sana Mheshimiwa Prime Cabinet Secretary, waziri wetu wa afya, governor, all protocol observed, na wageni wetu. Hamjambo? Mrembe. Unajua watu wameongea Kiingereza na Kiswahili mpaka mmesahau. Mrembe. Asante sana Mheshimiwa waziri, karibu nyumbani mara tena. Waziri wetu wa afya na wageni wengine, mimi naitwa Eric Odei Ubamu nikiwa Deputy Speaker Vihiga County Assembly. Nachukua hii nafasi kwa kusema asante kwa kuja Vihiga, na mimi nakuomba waziri, kama msichana wetu kutoka hapa Western, usingoje hata Mheshimiwa Musalia aje kwa ofisi yako ama Mheshimiwa Governor aje kwa ofisi yako. Jua tu Vihiga ni county na iko na department ya health. Wewe ukipata vifaa za afya lete Vihiga. Zingine zikija hapa kwa eye hospital, zingine zitaenda pale referral hospital, zingine zitaenda district hospital ya Sabatia, zingine zitaenda pale mimi natoka Hamisi sub county hospital, ili zisaidie watu wetu wa Vihiga. Sina mna hivyo watu wetu wa Vihiga. Na unakaribishwa tena next time ukija kuja na lori imejaa vifaa kabisa, ziingie kwa hospitali zetu. Asanteni sana.
Thank you, Your Excellency. I will just say two words. Number one, I want to appreciate your vision for this Sabatia. Mheshimiwa Mudavadi, tunataka tukushukuru sana kwa sababu wametuambia pale kwa boardroom, hii hospitali kuanza ni wewe ndio ulikuwa na zile fikra za kuanzisha hospitali ya Sabatia ya macho. Tupigie Mheshimiwa Mudavadi makofi. Na Mheshimiwa Mudavadi, tunashukuru kwa sababu mimi kama MCA pale Vihiga County Assembly huwa naambia wenzangu, I'm the only MCA who has an eye hospital in his ward. Not in Vihiga alone, even in Western Kenya. Sasa hiyo ni jambo najivunia kwa sababu ya wewe. And this hospital is doing good work. Is doing a lot of good work. And I was asking myself, if this is a hospital that is run by a board of managers, what's happening to our public hospitals? Because unaona hii inapewa tu pesa na partners. Lakini in public hospitals inapewa pesa na serikali. But if you go to a public hospital, you can give up on your health. So I would wish those public hospitals that are struggling to sustain themselves, they come and benchmark at Sabatia Eye Hospital for better management. I want to appreciate the chairperson and the board. You are doing a good work. Madam Cabinet Secretary, my last request is, and the governor is here, who is we are working together with him very well. If you are a rich neighbor and across your fence there is a very poor neighbor, if you don't take care of that poor neighbor, he will be stealing from you. Ni ukweli ama ni uongo? So this hospital, eye hospital, is a very good hospital. But across the fence we have a very poor hospital called Sabatia Sub-County Hospital. Bwana Cabinet Secretary for Health, my request is, Madam Cabinet Secretary for Health, my request is, and we wanted to transform this hospital in memory of Mama Hon.Mudavadi, to call it Mama Hon.Mudavadi Hospital, like Mama Lucy Hospital in Nairobi and other hospitals. I'm requesting humbly in your budget, because what comes to the county government is very minimal, and what goes to health in the county government pays only salaries and do very little development. As governor will be struggling to put some money, I'm requesting, if you can get 100 million from your department to come to Sabatia Sub-County Hospital to facelift this hospital so that we can call it Mama Hon.Mudavadi Hospital. Munaungana na mimi kuomba hiyo maneno? Wangapi wanasema tupate pesa tujenge hospitali hii yetu? Haya, mama waziri, Mheshimiwa, hiyo sio maneno yangu, ni maneno ya wale ambao walinichagua. Kwa hayo mengi, Mungu awabariki sana. Asante, back to the MC.
Asante, tumpigie makofi Mheshimiwa MCA wetu.
I'm sorry, they are saying that the representative for the member of parliament for Vihiga is here. So I think our member of parliament will give you recognition. Thank you.
Asante, tumpigie makofi Mheshimiwa. Basi kwa ruhusa yako mkuu wa mawaziri, sasa umewadia wakati wa kumwalika mbunge wa eneo hili ambaye ni Mheshimiwa Clement Sloya, na atakapomaliza kuzungumza nitamuomba amwalike gavana wetu Mheshimiwa Wilbur Tichilo, ambaye pia akimaliza kuzungumza atamwalika waziri wetu wa afya Susan Nakhumicha, ambaye naye atatuletea mgeni wetu wa heshima mkuu wa mawaziri Musalia Mudavadi. Karibu Mheshimiwa.
Asante. The Prime Cabinet Secretary Musalia Mudavadi, our CS for Health Susan, our Governor Wilberforce Tichilo, all the MCAs who are here, the County Commissioner, Deputy County Commissioner, our chiefs, and all protocols observed. I want to take this opportunity to thank all of you, first of all, for attending this function, and two, I want to take this opportunity to welcome everybody to Sabatia Sub-County, which is a constituency where the Prime Cabinet Secretary comes from. We have gone round and we have seen what is happening. And before I say anything, in a very few minutes, I want to recognize the presence of the representative for the Member of Parliament for Vihiga constituency, who is Honorable Kagesi. The representative is here. You can. Mr. Wandala is here. So in all this, we are having all our Member of Parliaments from Vihiga with us. We are partnering with them in each and everything that we are doing to ensure that we have a sub-county hospital here and the eye hospital, which we are celebrating the opening of 2 new wings, which are going to be of great importance to this institution. To our Cabinet Secretary in charge of health, we value what you are doing, and we want to pledge that we will support you from here where we come from. I have seen the children that are being taken care of at this facility are many, and this means we have the capacity, and we should also be looking for more capacity to hold many of them, because we have so many people who are suffering from eye infections and so many other things related to eyes. So I want to congratulate the board of management of this institution, the CEO, and many other people who are partnering with us, the CBM and the Rotary Club, who have assisted us so much. With me, I want to also pledge my support. From the CDF, we are also going to sit down with the board, the committee. Once we receive our money, we will also be supporting this eye hospital with something small to ensure that their operations are running smoothly. Before you, the Prime Cabinet Secretary, I also want to request the Cabinet Secretary in charge of health that we also have a sub-county hospital here. Like the area MCA has said, that sub-county hospital needs proper assistance. We are lacking equipment, staffs are few, and we know the CS for Health can assist us to have enough staff being sent here. And even before staff are sent, we need to renovate that hospital. Through your assistance and support, we know we are going to achieve all this. We also want to report to you that we have enough land that can be used for expansion of that hospital. And two, we are very much ready to offer you support that you may need towards realizing the same dream. We have staff, like I have said, that we need to motivate. These staff who are serving us here at the eye hospital and at the Sabatia Sub-County Hospital need proper motivation. Let us look at how we can partner together and ensure that we are assisting them in the best way possible. To finish with, when we were burying the mother to the Prime Cabinet Secretary. I heard the governor himself say we will rename our sub-county hospital Mama Hon.Mudavadi Hospital. But like the MCA has said, we cannot rename it the way it is. We want it to be upgraded to a level 4 hospital, because like it is still running and operating as a level 3 hospital, which we really need to upgrade for it to be functional and rename it to Mama Hon.Mudavadi Hospital. Cabinet Secretary, we also have a training center, the KMTC, that we are putting up in this sub-county at Kegondi, and we want you to kindly intervene so that you also support us financially so that we can finish, we can do completion of the same. And probably you assist us. There is a Kegondi Health Center where the KMTC is being built, which we would want to also be upgraded into a level 4 hospital with a maternity wing and a theater to assist the students who will be coming there. With those few remarks, I want to say thank you. And I had requested the Cabinet Secretary that after I deliver my small speech, I have somewhere to rush to, and I'm very sure he is going to grant me the opportunity to leave so that I go attend to something else. But in all we are doing, and I've pledged support to Sabatia Eye Hospital. Once and when we receive our CDF, we will be doing something to this hospital. Thank you.
Tafadhali mheshimiwa, tuletee governor wetu ili naye atuletee Madam CS atakayetuletea.
Thank you. The Prime Cabinet Secretary, I want you to ask you for permission for me to invite His Excellency the Governor for Vihiga County, who we value most, and even as his term comes to an end, we know he is going to do some good job for us in the remaining period. Welcome, Bana Governor.
The Prime Cabinet Secretary, our own Honorable Dr. Wycliffe Musalia Mudavadi, our Cabinet Secretary in charge of health, our own Honorable Madam Susan Nahumicha, our MCS who are here, our development partners, the national government team led by the county commissioner, the board of this very important hospital, and the members of this community. First, I want to start by saying we are very, very happy and grateful to God for those who had the vision to establish this hospital. This hospital is playing a very important role in the area of treatment of eye ailments. It is the only hospital in our region, and I would say it's one of the few special hospitals in the country that are giving specialized treatment. So I want to thank the board through the chair, my good friend Lulu. Thank you for the good job. I also want to thank the staff for the good job you are doing. Further, I want to thank our development partners who have stood with us, who have worked with us to bring this hospital to where it is. We want to say we are happy and we want to continue working together. But I want also to echo what the chair has said. Our development partners are helping us. We can also come out ourselves. I know we have people in Vihiga, people in Western, who can be able to support our health facilities and other social amenities. So let us not wait for the development partners only. Let us also help ourselves. So I would like to re-echo that. As a county, we have agreed to work very closely with the management of this hospital. We have entered into a memorandum of understanding where we are going to work together through our partner, the CBM, who have generously helped us establish an eye unit in our referral hospital at Mbale. And they have equipped that eye unit. We have agreed we will work together, and particularly on the outreach program. And the outreach program that so far we have carried out has shown that Vihiga has a lot of problems with eye illness or ailments. So we need to really intensify our outreach program. I want to assure you that we work together. And finally, as regards to the Sabatia Sub-County Hospital, I want to agree with the MCA for the area and the MP for the area that this sub-county hospital needs a major overhaul, a major renovation before we rename it as Hon.Mudavadi Hospital. As a county, we have already earmarked to do the renovation, but as it has been said, we do not have enough money for the development. So I also want to join my colleagues to appeal to the ministry to come and also give us some help. But I want to assure the minister that we as a county, we are already planning to do the renovation and the uplift of the hospital. So they are coming in will be also partnership. So with those few remarks, it is now my single honor to invite our guest, Honorable Madam Susan Nahumicha, our CS Cabinet Secretary, Health, to come and talk to you. Karibu.
Thank you very much. The Prime Cabinet Secretary, His Excellency Musalia Mudavadi, the Governor of this great county of Vihiga, Your Excellency Governor Otichilo, the County Commissioner, Mr. Kitio, partners present, area MCA, the Chair of the Hospital Board, together with your board members, management and staff, and all stakeholders of this hospital, ladies and gentlemen, good afternoon. Murembe, Muribalam, Asante. Indeed, it gives me great pleasure to join you, Prime Cabinet Secretary, and join the hospital on this auspicious occasion of the launch of their pediatric unit together with the training center. And having looked at it, this is a center that is going to serve not just the people of Vihiga, but far and wide in the country, as it forms a major cornerstone of the specialist eye hospitals that we have in this country. Prime Cabinet Secretary, there is a rapid assessment that is ongoing on avoidable blindness. And currently, the statistics as at December 2022 indicate that 4 out of 1,000 people in Vihiga County are at risk of blindness, yet these are treatable conditions. PCS, this translates to about 2,500 blind persons in Vihiga. In that estimation, we can project up to 200,000 Kenyans that are at risk. And therefore, I'm so happy to stand here and support this facility in the endeavors they're putting in to ensure that we are able to manage eye diseases in this country. We need to understand well that although you may see about 15,000 children blind in the country, them living with that disability is a huge loss to this country on matters economy. And you know, PCS, as a country, we are in a difficult space, a difficult physical space. So we have an opportunity to ensure that each and every Kenyan is productive. It is sad that blindness at times causes stigmatization and social exclusion and eventually depression of blind adults. And obviously this lowers their morale and participation in other activities within the society. PCS, it is known that early identification of the child with blind eye disease or even sight-threatening diseases is therefore paramount to achieve good treatment at an early stage so that we get good outcomes. It is therefore my passionate appeal to all of us to proactively look for these children in our community in the earliest possible opportunity. And PCS, this falls in line with what we are doing at the moment at the Ministry of Health. On several occasions, I have told Kenyans that as a ministry, we are now not focusing on curative services only, but we want to give emphasis to preventive and promotive healthcare. And to achieve that, we are going to launch over 100,000 community health promoters. And in my discussion with the governor early in the morning, he told me that in Vihiga, he has over 1,500 community health promoters. Tupigie Governor makofi. And I want to assure you, Governor, that we are going to work with you. In a month's time, I'm going to bring gadgets like this one I'm holding for your community health promoters. In a month's time, Governor, I am going to bring you a kit for your community health promoters. This kit is worth 45,000, Governor, and it has the basics that they can use when they go into a household. My plan as the Minister of Health is to ensure that one community health promoter is actively looking at 100 households. Wako na kit ambaye nitawapatia. Katika hiyo kit kuna weighing scale, wakija kwa nyumba wanapima, wanaona kama mko sawa sawa uzito wenu. Katika hiyo kit wanapima pia kama kuna mtu akona ugonjwa wa kisukari, ili wakaweze kumwelekeza hospitali. Hawa wataweza kufanya the basics within the household. Pia wataweza kuelimisha jamii mambo ya nutrition. Wale vizuri, matunda, mboga, ili kuhakikisha afya yao iko nzuri. These community health promoters are then going to feed into community health units. And these community health units will then feed into what we call a primary care network. And I want to thank the Hospital of Sabatia Eye. You are ahead of me. Because from your explanation, on your board, you have a community representative, you have partner representative, you know, and you have your technical people on that board. That is what we are envisioning for the primary care network. So that if the Vihiga, if the Sabatia sub-county is the headquarter of the PCN, then we shall have a governance structure that includes the technical committee from the sub-county who will be health professionals. That governance structure will include a representative from the faith-based institutions. That governance structure will include a representative of the partners. That governance structure will recruit a representative of the community. And lastly, that governance structure will include a representative of the special interest groups, either our mama or somebody living with a disability. What am I doing with this? We want to introduce transparency in how we run our hospitals, our public hospitals. Kenyans are suffering because of wastage of public resources. As a minister, I have said I shall not oversee public resources wastage. So I agree with you, MCA. It is only a matter of time. In a few months' time, we are going to roll out that. We are working together with COG to ensure that we have proper governance structures for our hospitals so that then they are able to manage their affairs. And Governor, we also want to pass an FIF bill that will ensure if the sub-county hospital here, Sabatia, collects funds, then the board will sit down and agree on what they want to use with those funds. Because at the moment, I am sorry, Your Excellency Governor, that these hospitals collect resources, but when they take it to the joint account of the governor, of the county, sorry, not yours, there are different priorities. Pesa imetolewa kwa hospitali, but unaona inajenga barabara. Hospitali inaendelea kukosa dawa. Ama pesa imetolewa hospitali kwa wagonjwa, but the hospital sees like the most important thing is to build a beautiful gate that does not add value to the patient. So now we are going to have a governance structure ya kuhakikisha kwamba hiyo pesa imetolewa hospitali, inarudi hospitalini, kuhakikisha kuna dawa, wafanyikazi wanalipwa, na pia kuna equipment. Ladies and gentlemen, I cannot overemphasize. It has been demonstrated here that partnerships and collaborations in health works. You can see the partnership of CBM, the partnership of the Rotary Club, and all the other partnerships that have been demonstrated here have worked to ensure that this facility works optimally. And for the few years I've lived on this world, I have never heard about misappropriation at Sabatia Eye Hospital. It means partnerships work. Sindio? It also means that the management does a good job. It also means that the hospital has a good health workforce. And during my leadership PCS, I have said the most important asset that we have in healthcare is the health workforce. As your minister, I want you to be treated with dignity, with value, lakini pia nyinyi muajibike kazini. Ama namna gani nurses? Si namna hiyo? Hivyo tu pole pole. Nifanye upande wangu, mfanye upande wenu, na wananchi wapate services. So we shall continue as a ministry to facilitate partnerships where possible, and especially we want to achieve universal health coverage. We must bridge the gap that persists in partnerships where resources are allocated but very poor accountability. I am aware also, and from our discussion in the morning with the chair, you have indicated the shortage of the health workforce. I want to assure you that as I go back to the ministry, together with my director here, we are going to sit down so that we get your immediate needs, and I shall address them immediately. In conclusion, ladies and gentlemen, I want to call upon all of us, and the chair of the board alluded to it, that it does not matter what kind of support it is, however little it is. When you can, please contribute to noble causes like such a hospital. And I'm sure that this hospital is going places. Lastly, PCS on the national issues. The last few days, I'm not sure if there's the regular media, but I would like to say that Indeed, I did say that the government is broke, and it's not a secret. It is. And therefore, we had small challenges and delays on disbursement of funds to the National Health Insurance, NHIF fund. However, I am happy to report, PCS, as at this morning, I received a call from Treasury that funds have now been disbursed to NHIF. And now, the facilities, which I'm sure this is one of them, once your claims are verified, you are going to receive your payment. I want to call upon all other healthcare providers that they resume services, those that had stopped, as we process claims and ensure that we make payment. But again, I want to assure you that I am not going to oversee graft. I am going to ensure that we optimally use the scarce resources that are allocated to us. Balogoli, Mlembe, Mubebalam, Mwayanza PCS, Sali mwana wenyu, Sili mtoto wa hapa. Ala mimi na Hon.Mudavadi natoka tu hapa ng'ambo hapa tukitale, mimi msichana Bukusu. Na sisi Waluo tukipewa kazi, tunaichapa sawa sawa. Na nataka kushukuru PCS kwa sababu he's my elder and he has been holding my hand in all the places that we go. Ananiambia na Hon.Mudavadi, kanyaga hapa, fanya hii, fanya hii, fanya hii. PCS, thank you very much, sir. I appreciate that. Na sisi Wabukusu tunasema courtesy begins at home. Nadhani wazungu walikopi kwa sisi Wabukusu. Na kwa sababu PCS hapa ndio nyumbani, it will be a shame if I don't support him, especially on health indicators. And I want to commit to Balogoli that moving forward, I am going to ensure the health indicators of this county, working together with your governors, are the best. And Governor, thank you that you are doing a good job. We shall work together. All I need from you is a letter telling me what you need to facelift the sub-county hospital. Once I have that request, I'm sure the PCS will support me in cabinet when I say now allocate 100 million to the sub-county. Sinamna hiyo? And all I want, Governor, barua tu, you know, we live in a world where you must ask and then be given. Sitaki kuimagine mnahitaji equipment. I want to know exactly what it is that you need. I don't want to imagine that you want maybe to do some infrastructure or changes. Please indicate what it is that you want. We shall work together and deliver it within the shortest time possible. And because I honor women, I agree that after we have done what we have done, then we rename the facility to Mama Hon.Mudavadi Sub-County Hospital. With those very many remarks, it is now my singular honor and opportunity to invite the son of this soil, none other but His Excellency, the Prime Cabinet Secretary of this country, Honorable Musalia Mudavadi. Welcome, sir.
Please be seated. Madam Susan Nakumicha, the Cabinet Secretary for Health, Your Excellency Governor Otichiro, Wilbur, the only one, the MCAs who are here with us this afternoon, the chairman and the board of the Sabatia Eye Hospital, the management, the staff, and our partners who have been mentioned by the chairperson, and also our county administration, and my good friends, some of whom I can see as I look through the tent, I see people with Mahoru. Ladies and gentlemen, Mirembe. Hamjambo. My first question to you is this. Susan anatosha ama hatoshi? Asante sana. She has spoken so well, she has communicated effectively, and it is clear that the President did not make a mistake in identifying her as our Cabinet Secretary for Health. So, Madam Susan, asante sana. And I want to say that I know you're going for another function shortly on matters of health again, but on behalf of the Sabatia Eye Hospital and on behalf of the people who are gathered here, let me say that we are deeply honored that you agreed to spend some few hours here to inaugurate the pediatric wing and to also talk to us on matters of health in our republic. And the commitments that you have also pronounced that you will be looking into, not just for Sabatia Eye Hospital, but in the context of health in the entire country. We thank you and we really appreciate the policy statements that you have made here. Watu wa Sabatia Eye Hospital. It is now about 27 years since we started this program. The success of this institution is vested in others who are not with us here today. They were here, they have gone. There are those who are running it today, and there are those who are going to continue with the process. It is important that as we mark 27 years, 27 of this eye hospital, we give a round of applause to the management team and the board because they have made us proud. They have engaged with the stakeholders very effectively, CBM, Lions, the Rotarians, and our other players, the University of JUCAT, the ministry. They have engaged very positively. And in the process, this hospital has seen better things. It has some of the state-of-art equipment. And as I was walking, I was just asking, and how much would this one cost? And they say, this one, just a piece of equipment. This one is worth 5 million. This one is 7 million. And there are others that are worth more. Inside here. This hospital, as you know, you can actually have your eye operation through laser. Through laser. In the middle of this county, you can actually have your eye dealt with through laser. That's not a joke. It's a very, very serious achievement. And we must consolidate and build on it. Looking at my notes, countries like Rwanda, Burundi, Cote d'Ivoire, Botswana, South Sudan have benefited from this institution, and cumulatively over 30 specialists have been trained from those countries through this institution. So you are also diplomats. Because through that outreach, you are now reaching other nations in this very specialized area. So we need to really harness institutions of excellence, institutions that provide unique services in our various sectors, and here specifically in health. They are now they've dedicated the children's wing, then you have the grown-ups, then you have the facilities that go here. So let us always embrace good management. And one of the things that I also say is strong with this institution is that it has embraced working with people from all over the country. Mr. Chairman and your team, you have done us proud. You have not been inward looking na kusema kwamba hii ni ile alafu tunaweka ukabila ndani, and you don't want to work with everybody. Everybody works here. That is how national institutions should be. That is how we can grow our country, by bringing everybody and working together. Madam, the NHIF, you touched on it. Kaza kabisa. Kenyans really want to benefit from that universal healthcare program, and the support of an efficient NHIF is absolutely critical. I have taken very positively, and we have taken positively, your message about corruption, ufisadi, and the way you quickly worked with the president to deal with the KEMSA problem, extend that whip to other institutions where people are misusing public resources, especially in the delivery of health to our people. Let us fight corruption. Let us make sure that we deal with that particular issue. I also want to say that I'm so happy that we are working closely with Governor Wilbur Otichilo and his team. That again is what makes sense and what should be done. When you have gone through an election and it's over, it is time to move on. And it is time to start looking at how do we offer solutions. And I speak here, I've had the crown, the heart of being a Minister for Finance in this country for 5 years. And I can tell you that I know the kind of dilemma we are in. It's a very serious dilemma. When I see a banker like Azilkam Mudika there, I am sure he knows what I'm talking about. We are not sitting well in terms of the resource base of the country at this point in time. And when you are sick, when you are in the hospital and you're going through that medication, some of the medicine is not sweet. Some of it is bitter. Some of it is bitter. But you have to take it in order to recover. If you decide that you don't want to take the medicine, you will perish. So I say so because I want us to look at this in terms of recovery, but also look at it in terms of a moral question, and then we see how we can adjust. And when you criticize, offer an advice. Offer advice. We are here asking Madam Susan Nakumicha to help us renovate or do a facelift on this hospital here. The governor, you're asking the governor, you want roads and so forth. But then on the other side, you are saying, remove this tax measure or this revenue measure, forget it. So where do you expect Susan to get that money? Where do you expect the governor to get that money? So when you talk and provide a solution. If you are saying that this revenue measure is not correct, please don't just criticize me. Give me a solution. If you don't want it this way, what is your view? So that that financing gap, I can also fill it. These are the questions that we need to ask. There's a controversy, maybe around the housing levy, but I also want to ask people, let us now maybe debate on the quantum, but not the principle. Let us debate on how you would want us to manage such a fund so that money is not misused, but not necessarily the principle of us supporting the other. It is like me waking up and saying, I educated my children. I have finished paying school fees. Why are you asking me to contribute to an education fund? And I've finished. Nzindamara ndaso minya bange. Nombolande atinzi kukonya na kumbaka ibukuri. Nende kumbaka irusengeri. Na bange bamara. Utandetera gena agadawe nzindamara gange. Do you see that is the message we are telling people? The ones who are talking are actually sending a message and saying because they have built a house somewhere else, the house is good, the house is in Musalia, the house is in Lavington, the house is in Diani Beach, the house is in Malindi. You are telling people, because I have built my house in Malindi, I have no business whether my neighbor is sleeping in the rain or not sleeping in the rain. You, in your own heart, is that correct? I have built the road. If I leave Nairobi and I'm coming to Chavakali, I'm on tarmac. Barabara ni safa. But you have been paying road maintenance levy, isn't it? You have been paying petroleum development levy. So you sit up and you say, because me, I drive from Nairobi to Chavakali on tarmac, the people who are driving from Kapenguria to Lodwar, it's none of my business. If the road is not tarmacked, shauri yao. Kenyans, let us ask ourselves some of these questions. Some of these hard questions. When the Prime Minister of Singapore came to Kenya the other day, the Prime Minister of Singapore, of course they have a small population, 6 million people, but he said 85% of the Singaporeans live in a house where the government of the day of Singapore has contributed to the construction of that house. You have your brothers and sisters living in squalor, living in difficult situations. We can talk about it, but as I said, now maybe we should shift the debate, not on the principle, but maybe let us engage on the quantum. Let us perhaps debate the quantum. But the principle, and the Constitution is very clear, in the Bill of Rights, the government of the day must guarantee shelter, must guarantee food, must guarantee health, must guarantee education to the citizens. It is in the Constitution. So, you, the day you will be sitting in my position as Prime Cabinet Secretary, tell Kenyans how you intend to fulfill the constitutional obligation. Because it cannot be for free, and it is not manna from heaven. We will have to work for it. But let us debate and debate while offering solutions as we move ahead. Susan, thank you so much. The leadership of the hospital here, asante sana. And it's a very green area. I'm sure you can all see the greening of when you have a hospital in the middle of greenery. People don't even know that the hospital is here until you move in. Then you realize that the environment is so good, even for recuperation, for healing. When you are able to see the greenery and walk around, unapona haraka. Ama namna gani? Unapona haraka. And please take medical care seriously. What Susan was saying about the health workers on the front line is very important, because some of us may not know that we have diabetes, as an example. And one of the earliest signs about a condition of diabetes sometimes is usually the eyesight beginning to wane and eventually maybe disappear. Sometimes it's not the eye per se, but maybe it's a condition around something different. So let us always check ourselves. Let us always try and save a stitch in time, because a stitch in time saves what? 9. A stitch in time saves 9. And as I conclude, I want to appreciate and recognize all the people who have journeyed over the 27 years to make this hospital what it is. The ones who donated the land, the church that partnered with CBM, everybody who has been party to this success, tunasema asante sana. Let us continue working together. We will seek more partnerships so that it can become even bigger and better equipped going forward. And I can tell you that with the collaboration of the Ministry of Health and the team and the University of Jomo Kenyatta University College of Science and Technology, JUCAT, if I can visualize what it will be, if we really just continue pushing together, I think you are in for very, very big news in the years to come. So tushirikiane na tujenge hospitali, and thank you so much again for attending and being with us today. Tutarudi tena kwa mipango tofauti. I can only encourage the members of parliament and the MCAs. Mimi sasa, you know, I'm not a member of parliament, but we must work with them and we must encourage them. We must encourage the MCAs. We must encourage the governor. Na governor, wewe shikilia kabisa. Ukiniona, usiangalie nyuma tena. I'm giving you the message that this is our governor. Let us embrace him. Let us work together. Thank you so much. God bless you all. God bless Sabatia Eye Hospital, and may it continue to prosper. Asanteni.
Asante, asante. Tumpigie makofi Mheshimiwa mkuu wa mawaziri wetu Musalia Mudavadi. Na kwa sasa nitaomba tu kwa heshima na kwa ruhusa yako Mheshimiwa, tuwe na ukataji keki mfupi tu wa kuadhimisha miaka 27 tangu kuasisiwa kwa hospitali hii. Utaongoza ukataji keki huo, na wakati wanapojiandaa kwa ukataji keki huo, heshima tena Mheshimiwa Mudavadi, nimtambue